traumatic and brain injury survivors, gunshot survivors, stroke survivors, AVM survivors, survivors of rare conditions, survivors alike, the wheelchair and disability community, caregivers, medical professionals, organizations, and anyone associated with brain injuries to share their stories and provide tips plus resources and bring awareness to those impacted. So on this episode, guys, it's the last episode of season 3. I'm on a brief hiatus for the month of November due to some personal things that had going on in my world, but I'm back with one last episode for you all to end the year. And thank you all for joining me for today and take your time out of your day to join me. However, my guest today is very knowledgeable in the physical therapy and neural healthcare space. She's a physical therapist, DPT, which is Doctor of Physical Therapy, brain injury specialist, and also does nerve. She's also does things involving the nerves. She does a nerve conductive study. So, however, her most important titles are she's a wife, I believe in a mom of two beautiful children. So let's welcome another world changer, Jenna Tucker. Hi,
Hello.
Jenna, how are you?
Good. Thank you so much for having me today.
Yeah. So you are married. Are you married? Are you married or
I am, yes. I've been
okay?
married actually
So I was
10
like,
years, 10 years
oh,
this year.
oh, well, congratulations. So I was like,
Thanks.
I don't know. I think she's right. I don't know, but I've seen a picture of her husband, of me, so I think it's her husband. So it's
Yep.
all, that's all right. So thank you again for taking time out to join me today to this interview. I really appreciate it. And so I would like to start off with you introducing yourself and my audience know how your interest in physical therapy began.
Yeah. So, as we said, I'm Dr. Jenna Tucker. I have been a practicing physical therapist for almost 12 years now.
Okay.
And I spent the last about 3.5 years in academia. So I now teach full time in a physical therapy program at Kean
Okay.
University. I also do still treat a little bit. I still work per diem as a physical therapist at Kessler Institute for Rehabilitation in West
Okay.
Orange. Um, but how did I get into physical therapy?
Yes.
I originally wanted to be a neurosurgeon. That was my childhood,
Mm, okay.
lofty goal. And then when I was in high school, I needed, some part-time work like many students
Hmm.
do. And I found a job through actually a friend of my family who owned a chiropractor's office. And
Okay.
she had hired a physical therapist to join her team. And I was there just a couple of days a week doing some like office work and things like that. And I got to
Mhm.
chatting with this PT, and he asked, what my goals were. I was a high school junior and, looking into schools. And I said I was very interested in being a neurosurgeon. And he's like, I
Mhm.
think you're a little too chatty for that. I think you need to be a little more involved. So
Mhm.
I did some chatting with him, and I found that physical therapy was a way to really blend my love of medicine and neurology, but
Mhm.
have the experience of really interacting with my patients and making a big impact on their day-to-day lives.
Mhm.
As opposed to, I mean, neurosurgeons are wonderful, amazing people, but
Mhm.
I don't
Sure.
think I was really meant to not interact, so much with my patient while they were asleep and I was doing their surgery. I love that I just get to spend so much quality time with them
Mhm.
and get to know them and their families, and so that's kind of how I wound up in PT school.
So you're pretty hands on. What I can sense. It's like a pretty hands on type of person. Like I need to get in a few items, so I can
Yeah,
appreciate that. I can appreciate that, and I can hear your passion behind behind your behind your expertise and your what you do. So it's very refreshing to meet people who are passionate about what they do and take it very seriously. And I know you take it very seriously, so I appreciate that. So how many years of physical therapy school did you complete to become a physical therapist?
so I went to Northeastern University and I did a
Okay.
unique program where I went it was a 6-year program that combined both undergraduate and graduate school. So in
Okay.
6 years, I graduated with my doctorate in physical therapy.
Okay.
Most programs, like the one I teach in,
Hmm.
is a 3-year graduate program after you've already done your 4 years of undergrad.
Okay. That makes
Yeah.
sense. Okay. Not too schooling. One thing about being a doctor, well, being a doctor, I know people are like, oh, it's too much schooling, it's too much schooling. you know. But I mean, if you're passionate about it and something you want to do, you're gonna do whatever it takes to do it. So I'm glad
Yeah.
you still good with it.
I tell my students that all the time. I'm like, if you don't love it, you won't
Yeah,
last. Like
yeah. So
you have to love what you do to really make it in this field.
totally agree. Totally agree.
Yeah.
So is there you say you don't practice per se in a particular clinic? You're more so I don't know, it's called what's the word? It's PRN. Is what they call it, PRN as
PRN.
needed. Yeah.
Yeah. So I treated full time for many years.
Okay.
And when I was a treating clinician primarily, I spent about 3.5, maybe 4 years, treating an inpatient rehab, mostly on the brain injury unit. I did a little bit in spinal cord injury and a little bit in other
Mhm.
areas, but mostly brain injury and stroke. And then I left and I was part of a comprehensive outpatient program that treated all traumatic brain injury for adults. And I
Okay.
kind of ran the PT program there. I did that for about 5 years. And then now I teach full time, as I mentioned, in the School of Physical Therapy, but I still work per diem. So I work a couple days a month at Kessler as a PT.
Okay.
And I'm often on the brain injury unit because
Mm-hmm.
as that's where my expertise is.
Mm-hmm.
Yeah.
Okay, that makes sense. And so when you were or you used to treat, but when you were really heavily into treating your client patients, what was the question you were most asked by your patient about their recovery? Like, how long is it going to take for you to do X, Y, and Z? Or, did you ever? I'm sure you did, but
All the
how do you
time.
how do you how do you answer that?
Number one question I got all the time was, when am I going to walk again? And when am I going to walk normally again? Or when am I going to
Mhm.
feel normal again? Those are the big
Yeah.
ones. And
Mhm.
I get it. It's a very daunting experience to just
Yeah.
have this abyss of recovery in front of you and have no idea what that recovery is going to look like.
Mhm.
And so over the years in my experience, I found that the most effective way was to help my patients and their families, because it's a big change for their families also.
Oh yeah. Oh yeah.
Help them to really understand that you have to focus on the current moment. What can you do
Yeah.
now, and what can we work on now to get you to the best possible place you can be? Um,
Yes.
and it's hard. It's really hard. We live in a world where we're always looking ahead. What's the next thing? What's the next thing?
Mhm.
And so to stay so focused in the moment is really
Mhm.
challenging. But I find that was the most effective way to just really kind of zoom in on what they were able to do at that time, and build off that.
That's pretty good. And I remember I've been in and out of my personal own journey for 14 years, going on 15 years now. And initially, I wanted to rush the process. Like, and I don't know if I know much from my story, but I was shot in my head, my straight bullet. And that's what led to my traumatic brain injury. And so of course, I'm okay. Once I know how to talk again and those kind of things, I'm like, okay, I'm ready to walk. I'm ready to walk now. Like, I'm ready to, get back on my feet. That's all I cared about, get back on my feet because I didn't know a life. I didn't know how to move in the wheelchair. I didn't know how to, be in the wheelchair. I never saw that for myself, and so it's hard to accept something that you never prepared for in a sense, And so I really struggled with that for a long time. And I was one of the people like, okay, what now? How long is it gonna be? Well, how long will it take? Not understanding that my brain has to be rewired, it has to heal, it has to, the neurons have to connect and all these things that take place and it takes time for your brain to heal. And it's just so amazing how I've grown to even look back and see my own progress and see how I was back then and where I am now. It's like a total 180. But it's
Yeah,
I appreciate the process now. I really do, and I'm glad I didn't. I'm glad it wasn't rushed because I wouldn't have the people I know now. I wouldn't have the things I know now. So it's been very rewarding
yeah.
journey. So
I find that brain injury can be blindsiding
yeah, yeah,
for both
yes,
patients, their families, their entire circles.
mm-hmm,
That it's you wake up one day and all of a sudden you can't do all these things, and not
mm-hmm.
only physically, but your things about how you feel and think and your process your emotions. Everything has
Absolutely,
changed, and
absolutely.
it's a lot to take in
Mm-hmm.
a short amount of time. And I think over time, people usually kind of like you said, learn to appreciate the process a
Mhm.
little bit and
Mhm.
get there. But that's a lot of effort, and I
Yes,
think you need
it
a
is.
lot of support to do that effectively.
Yes, absolutely. It take a lot. So it's not a one, two, three thing because you go through all different emotions. You're angry, you're sad, you're depressed, you're just all these different things. So
Yeah.
it's a whole different world. And a lot of people, some people are affected worse. Some people aren't affected as bad. So we're all different. There's no cookie cutter brain injury. So
Oh, that is 100% true. There are no cookie cutter brain injuries. It's funny. People ask me all the time, they're like, how do you do it? Because there's no, if there's a lot of PTs who are, let's say, for example, an orthopedic specialist. So they see a lot
Mhm.
of, like, I'll give just some examples, like a total knee replacement and a shoulder
Mhm.
injury and a knee injury, right? And there's some consistency there, right? Every person is different, but there's some
Absolutely.
consistency to those injuries, and being able
Absolutely.
to treat them. Whereas brain injury, you have no idea
Oh,
what you're going
yeah.
to get every time. You have no
Mm-mm.
idea what the recovery is going to look like. It's
No.
very, very variable. So
Yes.
but to me, I think over the years of treating it in the beginning, that was very overwhelming. Similarly
Mm-hmm.
how it is for a patient, like you don't know where to start. But over time, I kind of that's the part I fell in love with, in that
Mm-hmm.
there's so much available to you, and you have no idea where the recovery can go, and you can take it a
Yeah.
lot of different places. And if it's interesting to just kind of see how people are able to make that incredible progress.
It is, and recovery is I know they have these statistics or whatever that you recover. I guess it's like what 6 months to a year. The fastest like after your injury, then it's further along. But I've noticed that I recover at each facility I've been to. I'm still making strides and gains. So it's never ending journey. It's never ending process. So you can
Yeah.
still recover at all stages. It doesn't matter how long it's been. You can still recover if you work at it. You gotta do something. You cannot do nothing. You have to do something.
If you put that effort in, you can change your brain until the day you die,
Absolutely.
right?
No,
Like,
no,
your
no
brain is
plasticity.
totally pliable for
Yes.
your entire life. And it's all
Yeah.
about whether you're choosing to make those changes.
Absolutely.
You have to put that effort in.
Yes. I noticed that more and more. The neuroplasticity, right? The constantly
Hmm.
doing something over and over again to your
Yeah.
your brain. So yeah.
Yep. Oh, we were
Yeah.
just talking about neuroplasticity in my class
Really?
today.
Really? We're
Yep.
in alignment. We're in alignment.
I totally will.
Yes. So can you tell my audience the difference between a neuro PT and a regular PT?
It's a great question. So when you graduate from all physical therapists now have to have a doctorate in physical
Okay.
therapy. So
Okay.
all
Wow.
treating clinicians are doctors,
Okay.
have a clinical doctorate. When you graduate, you are considered a generalist, right? So you
Okay.
can treat basically any population. You've been trained to treat all of them. In Within the world of physical therapy, there are 6 board certification, I think it's 6 or 7 maybe now, board
Mhm.
certification specialties, and neurology is one of them. And so in order to become a board certified neurologic specialist, you have to either complete a residency program or complete, I don't remember the exact, I want to say it's like 2,000, 3,000 hours of
Okay.
direct patient contact. And then at the end of either the residency or the patient contact hour requirement, you take a second board exam, and then you're certified for 10 years, and you have to keep up with that every couple of
Mhm.
years. You are not required to do a specialty. Many physical therapists don't have one. You can
Okay.
continue to treat, and you don't have to have one to treat the neuro population. But it is important for patients to know that those who have that board certification do have some more advanced training and experience in treating those populations. So,
Okay.
yeah.
Yeah. Pretty interesting. And you want somebody to know what they're doing. Obviously, it's the brain is very complex, but you need somebody that understands exactly what's going on and specializes in that area.
Yeah.
I'm not a doctor by any means, but I can tell you what I know from what I experienced with my own self. But you want somebody that when I go to the doctor, I want somebody that knows what they're doing. I don't want
Yeah.
to go to somebody that's not aware of what's going on with my brain or you know doing this brain. So I thank you for elaborating on that, the difference between those two.
Yeah.
how do you remain professional and not get attached to your clients? Have you ever had a client that you were like, oh, I just want to miss them, you got attached to somebody? I know I have got attached to my therapist, so
So anyone who knows me know this is a tough one because I get attached to everybody. um, I become so invested in my
mm,
patients and the recovery process. It's a little different now because I'm not full-time treating. So I kind
mm,
of just come in and I see
yeah,
patients here and there. So
yeah,
that piece is different. But we are taught a lot of strategies in school on how to maintain that professional
okay,
boundary. I actually teach the course on professional boundaries. So there's a lot of strategies involved in understanding and just respecting the fact that you are the treated clinician, and you do
mm-hmm,
have to keep that bit of a barrier. But it's a
mm-hmm,
really fine line, and I'll be honest,
yeah,
I think the line fluctuates a little bit person to person. I think
mm-hmm,
different people need different connection.
yes,
So I think, you just have to be mindful of that, like you said, as long as you're being professional,
yeah,
um, some people need a little bit more kind of maybe emotional investment, but you just still have to remember to keep that kind of that barrier there in a sense.
yeah,
Um, it's a balance and it takes a lot of work, a lot more effort than people think. But like when I
that's
first
good.
started as a clinician, I remember when I was a student, I did a clinical rotation on a brain injury, spinal cord injury unit. And my first day, I came home and bawled my eyes out. And my now husband was like, "What's going on?" I'm like, "I don't know.
Mhm,
I can't. It's so much. Like it was so emotional." But another good piece that I've explained to my patients, I'm sorry, my students is
mhm,
when I first started, I remember looking at my patients and there are these very traumatic experiences they went through. They're in these very difficult situations, and it's
mhm,
emotional, it's overwhelming, and it's sad, and there's so many things going on. But over time, with experience, I started to, instead of seeing kind of the situation in front of me, I
mhm,
almost would see my patient as like a blank canvas and be
mhm,
able to visualize where they're going to go and kind of put on that professional hat to be like, I'm going to be the one to help you get there, not
I
do it
like
for
that.
you. We are
I like
not doing anything for people. We are always
that.
helping them to do it.
Yes.
And when I was able to kind of make that transition with more experience to say, this is where you're going to go, it wasn't as sad and as kind of
Mm.
daunting. But like I said, it takes time.
Yeah.
As a new clinician, that's a tough piece to kind of
Oh
deal
yeah, I'm sure. I had a physical therapist. I've had oh my god several numerous therapists, and through my first year, I only can imagine. And one particular therapist I had for mm, 5 or almost 7 years. And so you could imagine the attachment that came, from that. And when she left, I cried. Like I literally cried. I was like, I'm kind of, I'm not a very emotional person, but like when she told me I'm going to leave, I was like, well, wait a minute, like. What about my recovery? What about what's gonna happen now? Like it just because I had gotten so accustomed to being with her, and I think I saw her like maybe like twice a week, and for almost 7 years, like I was like, well, so
Well,
what?
that's the other interesting piece. Like I say this to people all the time. When you go to a doctor's office, how often do you
Mhm.
spend, how much time do you spend with them, right? You're in there for 15
15,
minutes,
30 minutes, 30
maybe,
minutes at the
right?
most. Yeah,
You're spending hours every week
yeah,
with your
yeah.
therapist, and so you build,
Daily.
yeah, every day.
Mhm.
And so you build a pretty big connection. And I think,
Mhm.
that doesn't just kind of disappear when you're
No,
done.
no, it doesn't. So I thought about that more. Like, oh, I remember that time, and so it's like I said, it's hard to not get that attachment, but it happens all the time. And I'm people that I'm very I get easily attached to people, and so I gotta always say, Erica, you gotta maintain, you gotta can't get too close. But it's so hard though. It's so hard.
It is. I mean, and then the bottom line is like, just like in any aspect of life, I think some people you kind of naturally connect with, other people
Mhm.
maybe not so much. So like there's a a good handful of patients that I've actually kept in touch with over the years that
Mhm.
that have reached out, and it's great. Like sometimes that
That's
evolves.
nice.
Yeah.
That's nice. So I know you mentioned you mentioned you're a teacher now. You teach you teach your physical therapy students. So what does a typical work day look like for you? As far as you go to are you like at the university? Are you I forgot what you said, but are you at the university or are you there now at the class or something like that?
Yeah, so I do teach full time. I
Okay.
am a full time faculty member at Kean University.
Okay.
So I am the Neurological Content Coordinator for the
Okay.
program, which means that I run and oversee all of the neurologic based courses.
Okay.
So, for example, I teach clinical neuroscience. I teach physical therapy management of the nervous system 1 and 2,
Mm-hmm.
and a bunch of other things. So what's interesting is my day to day is very, very different, which is funny because in the early part of my career, I basically just every day 8:30 to 4
Yeah.
saw patients 8:30 to 4. Now I'm kind
Mm-hmm.
of all over the place. Some
Mm-hmm.
nights I teach late, and I teach both classes and labs.
Okay.
So some days I teach late, I teach early, I have office hours, and then I'm doing quite a bit of research as well now.
Mm-hmm.
That's one of the requirements of faculty members. So there's a lot of times where I'm involved in different aspects of research projects that we have going on. And then a couple times a week, a couple times a month, I'm treating over at Kessler. And then
Mm-hmm.
in addition, we actually have a pro bono clinic on campus. So
Okay.
there's one morning a week where I supervise some students in the clinic, treating some patients. So I'm kind of all over the place day to day. It varies quite a bit now.
Okay.
It's
I mean,
different.
it's good. It keeps it fresh. It's not going to get bored.
No, I definitely do not get bored.
Yeah. Never
That
doubt
is all.
moment.
Yep.
Never doubt moment.
Yep.
So, what is one exercise that you recommend for people who sustain injuries do daily? That they can do
My
daily, whether in a wheelchair or okay.
my recommendation above all else is do something you enjoy.
Okay.
Whatever, because research has proven time and time again that if it's an activity that you enjoy and you feel benefit from,
Mm-hmm.
then you will stick with it. And the bigger piece is not necessarily, I mean, what you're doing does matter. Obviously, it should be safe,
Absolutely. Absolutely.
but it's more about consistency and sticking with it. So if you love to dance and that's the cardio you want to do, dance away. If you like to swim, if you like to run, if you like to do, and there's amazing adaptive programs for people that are wheelchair users, all different types of
Mm-hmm.
wheelchair. So just finding something that you enjoy that you feel like you can stick with long term. I think that's always my big recommendation.
I love that. I love that explanation for it. Do something that you enjoy doing. Because people, it's something like, oh, I gotta do this. It's like you're not gonna want to make when they do it. I do it tomorrow. You'll keep putting it off. So that makes a lot of sense. So I'm glad you mentioned that.
Yeah.
When did you know you want to extend your learning and well, I know you said it's mandatory now to get your doctorate in physical therapy. So when did you realize that I want to get more? I want to further my education and extend my learning. Take it
So
further.
yeah, so it's required, like I said, it's required now to have a DPT.
Yeah.
So I had that coming out of school. And then I took my first job at Kessler. That's where I worked full time.
Mm-hmm.
And back there now as per diem. I can't seem to leave there.
Mm-hmm.
Um, so when I started there, I didn't know what unit I would be placed on. And I got placed on the brain injury unit. And I had some incredible mentors. Quick shout out to particularly Dr. Karen Bay. It was amazing. But I had just had a wonderful collection of mentors on that unit, and they really helped me to just see what an impact I could have on this population. And I fell in love with how unique each patient, each treatment, each injury, everything was, which for some people, they don't like that piece because it's very, it can be overwhelming, could be whatever it is. But for me, that was the part I liked. And so I felt like I wanted just more in-depth knowledge on how to treat that population. And so I started working towards my NCS to become a board-certified neurologic specialist, as well as my CBIS to become a certified brain injury specialist. And I did both of those while I was still at Kessler. And again, just through a lot of mentorship, that was kind of my and my patients, like watching when they made big improvements. I'm like, well, I want to do everything I can to make that happen. So.
Yeah. Well, I can, you know, for physical therapists to see any type of fitness, like when they thought they can do it before, but then all of a sudden they could do it, especially if you work towards it. I'm sure that has to be very rewarding. So I just take me back to my moments. This is so rewarding, but it is very rewarding for both patient and for therapist. So it's very
Yeah,
rewarding.
it is.
And so you mentioned, I'm glad you mentioned the brain injury specialist. I actually myself, I want to do a CBIS as well. So what's the most what's your favorite part about, well, what do I want to ask? What in well not that. What is the difficult part about being a CBIS for you? How much you love the
Well,
brain? What's difficult for you?
yeah, I think so. I think the CBIS certification is interesting because you don't have to have a specific background to become a CBIS, right? Like, so a PT could do it, a caregiver could do it. Like, there's different anybody's background. So because I had a background in healthcare and I had years of experience on a brain injury unit, to become a specialist wasn't. I don't want to say it wasn't hard for me, but like it kind of fit with what I was doing
Yeah.
already.
Yeah.
And I just felt like it gave me that little bit of extra edge to be like, I have just enough more knowledge to kind of advance me a little bit more. So I always recommend to anyone who's interested, it can't hurt to explore it. I think it's a great opportunity to just always learn and grow and continue to
Absolutely.
build your knowledge.
Yeah, and I looked it up myself, and I guess I'm interested in being doing it as well. But the thing that gets me is the hours. Like I don't work with people who have brain injury. I don't so that's kind of where the downside is. Kind of like, so where
Yeah.
do you, like, you know, so I don't, like I said, I don't have a job in the
Yeah, so
particular.
that I'm not familiar with, like that piece on like the specifics, because I kind of did it through my work.
Yeah.
So
Yeah, so it
yeah,
kind of flow together for you. But yeah, when I look at the
yeah,
requirements, I'm like, if I think I had like required to find something hours, I'm like, well, how we get those? How we get those hours? But it happened. If it to happen, it happened. So I just curious and they take on that. What was the most challenging? But what's most challenging for you between PT, well, I guess it kind of falls in line. PT, DPT, and brain injury specialist. Was there one more challenging than the other that you found?
PT school
That's challenging.
is the challenge of all challenges, and my students will walking past behind me, right, behind the screen right now, are all probably thinking, "Yep, um, yeah, no, PT school will push you to your limits, which as I
Wow.
think it should, because you have to have not only just the knowledge, but the professionalism, the understanding,
Mhm.
the empathy, all these different qualities to make you a good therapist. And I feel like I know I loved the program I attended at Northeastern. My faculty was incredible at kind of shaping me into the clinician I am. But PT school definitely the hardest.
Hmm.
Taking a second board exam to become a
Wow.
neurospecialist. Most people thought I was nuts because they're like, the first board exam's hard enough. Why are you going to choose to take a second one?
Mhm.
But I just really felt like it was the path I was meant to go down. And at
Mhm.
that point, because I had a lot of experience, I don't want to say it wasn't as hard, but getting the NCS and the CBIS, just kind of felt a little, kind of the natural progression of my career.
Mhm. I like that. It makes a lot of sense. I have a question that I didn't um, originally say to you, but do you have any tips on how to alleviate head pain?
Tips on what?
How to alleviate head pain? Since you did neuro, is there any like tips you can give that can provide some relief to people who have headaches or experiencing?
So it's so funny. Every PT student will tell you the classic professor response is, It depends.
Okay.
It's always because there's so many things that can contribute to it. But
Hmm.
I would say if you're not, obviously, always first seek medical advice to make sure there's not some kind of underlying cause and something else
Yeah.
that could be caused. But there are a lot of what we call mechanical causes of headaches that
Okay.
I think fall by the wayside because there's so many other symptoms of brain injury that really take priority in a lot of ways.
Hmm.
But physical therapists can also look at different things such as like your neck. Is there something coming from your neck causing headaches?
Hmm.
Are there different, is it a visual thing that they can work on?
Hmm.
There's visual therapy you can do. So I think consulting with your team to see if they can do some specific testing, because sometimes it's actually even a quick fix, not always, but to just see, because you never know if there is something simple that they can do. So just for an example, like if your brain injury was from a car accident, right?
Hmm.
Often they're focused on just stabilizing you medically and all that stuff. But
Hmm.
how many times in a car accident do you also get whiplash,
Yeah.
right? And that becomes kind of put to the wayside. But over time, that neck
Positive.
injury can kind of contribute to things. So just kind of
Hmm.
ruling out that there's not something else going on.
Yeah.
For
I
the most
found that for me personally, since I am in a wheelchair, leaning back, helps take the pressure off my head. I'll lay down, like if I feel it's too much. Of course, I told you to drink water and make sure you're hydrated. And it's one thing
yeah,
that goes to
definitely.
the wayside because it's like water. Like, oh, you don't think that about water, like water can be affecting your head. So you don't think about that. But drink some water. It makes more even see the difference. So.
Yeah, dehydration is a huge, huge, huge cause of headaches. So
Mm-hmm.
definitely always making sure you're hydrated is
Mm-hmm.
crucial.
Yeah. So going switching gears a little bit and going
Yeah.
to what you say you speak whatever. So I've seen you do numerous speaking engagements. What is one takeaway that you want your audience to get what takeaway you want artists to have from everything you talk about?
So I would say I do a lot of presentations to
Yeah.
healthcare professionals, but also
Mm-hmm.
to brain injury survivors as well. And I
Mm-hmm.
think to both the patients, the caregivers, and to the healthcare team, the number one thing I would really recommend is remembering to have patience with
Mm.
yourself, with everyone around you.
I like that.
It's a process. It's often a long process, and it's a
Mm-hmm.
variable process. And you're gonna have setbacks, and you're gonna have good days and bad days. And I think
Absolutely.
you kind of having a lot of patience and learning to kind of take the good with the bad and
Mm-hmm.
working through that is such a big piece of the recovery process.
Yes.
And kind of going off that, not don't be afraid to rely on your support system.
Mm.
So for patients, relying on your family and your caregivers and your friends and your healthcare team, but also for caregivers, rely
Mm-hmm.
on your support system. You need support too. Like
Oh, yeah.
they need self-care just as much, right? They tell you if a
Mm-hmm.
plane's going down, you got to put on your own oxygen mask before you
Yeah.
take care of other people.
That's right.
And for clinicians, I to this day I have plenty of colleagues that will tell you if I have a case that I'm like, oh, I'm a little stumped here, like I'll reach out and be like, do you guys have any ideas? Have you seen anything like this? And
Mm-hmm.
that collaborative effort is going to be
Yeah.
the most efficient way to kind of move forward in the process.
That's very important. You touched on support. I would touch on that as well. And patience. Patience is the number. It's like it's like it's number one two thing because you definitely need support, but patience with yourself and like you said with caregivers on both ends. I have patience with you. You have patience with me. So it's definitely it can be a daunting process at times, but it's how you look at it. To your perspective, how you look at it as well.
Yeah,
So
yeah. Outlook
yeah,
is a lot. Like,
absolutely.
remembering that, and the last thing you actually talked a little bit about this earlier, but like never totally giving up. Like you
Oh
can
yeah.
have days where you're like, you know what, I'm gonna have a bad day today. It's
Mm-hmm.
just I'm gonna accept
It
it.
is what it is.
But for the most part, you'll never know your potential unless you try.
That's
And
right.
I can truly sit here and say I have seen recoveries that people would call miraculous. And
Mm-hmm.
I attribute it to the fact that they didn't give up. They and their family just did not give up. And, that looks different for everybody.
It does. Yes, it does.
But always having, I think, that hope and that drive to keep trying.
You gotta have it. That's the faith. You gotta have it. So, like I
Have
said,
it.
if you see a vision for yourself, it's like, why would you can't give up on yourself? Even if you don't have nobody to push, because some people don't have the support. Unfortunately, I feel so bad for those people that don't have the support from family and friends, But if you do have that support, if you do have that drive, that will take you a very, 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 very long way. And so, like I said, I'm in my journey along with myself. So I've been in the 14 years. I'm not stopping until I get where I want to be, which is on my feet again. So,
Yeah.
I
But
just,
even I've seen over the years patients who maybe don't have a lot of family, or you can find your support too. Like, there are always people out there. There's like, I do a lot of work with the Brain Injury Alliance of New Jersey, and they are an incredible organization. And there are always ways to find some more support or different support if someone can't give you the type of support you need.
Yeah, I absolutely agree with that. I absolutely agree. So after a long day's work, how do you preserve your energy for your family, your husband, your especially your loved ones? Yeah, you love people, don't you? You love kids, so they're
Yeah.
energetic. They're anybody. So when you get home, how do you remain energetic? What do
I
you
don't
do?
know. I truly don't know. I get asked this question all the time. So I think one of the hardest things in life is finding that work-life balance, and just being able to juggle a lot of things, and working 2 jobs and having 2.5 kids. Number 3 is on the way.
Congratulations.
Thank you. Yep. So it's a lot to juggle, but I think, my family is they're my, it's not escape from things, but like just spending time with the kids and relaxing with them at home, and my husband and my family is, I kind of look at that as my downtime, and I try to find pockets of relaxation where I can. But my students say all the time, I am like, go, go, go all the time. But I think I was just gonna say, the other thing that I recommend to everybody, because I think that's a barrier for caregivers, is they feel like they're go, go, go all the time. But just in general, like taking care of yourself. Like, I focus a lot on my nutrition and being hydrated, like we're saying, and exercising. And I think taking care of yourself gives you the best opportunity to have that energy.
Absolutely. You gotta take care of you. If you take care of yourself, you gotta take care of others. You definitely have to have that. If you have to be, and have, you can't part an empty cup. Is that what they say? Can't part an empty cup.
Yep.
So
Pour
you
from an
gotta be good too.
Yeah.
What ways do you decompress? You said you spend time with your family. Is there anything you do by yourself that you just that mommy time? Everybody have mommy time or a long time. So what do you do by yourself that kind of decompresses you, kind of relaxes you? Do you read? Do you go to the spa? What do you do that relaxes you?
So I do love to read. That is one, but my big one is running. I've been a runner for many years. I love running outside primarily if I can. I love being outdoors. So running, or even like yoga, hiking and biking, and I do love yoga as well. And just particularly if I can do any of those physical activities outdoors, that's my like self-care release time to just zone out, because when I go for a run, it's the only time I don't have a phone on me. So
Yeah.
I just feel like I can escape a little
Escape in the world.
bit. Yeah.
And it clears your mind. Like running is good for your brain, isn't it? It clears your brain and helps you on clouds and stuff, I guess. And so even exercise period, I believe it can clear your brain. So.
Yep. There's a lot of benefits, like on a very basic neurologic level, that can really help stimulate different areas of the brain and help maintain its function and things like that long term. So yeah, exercise is one of the best medicines for your brain.
Yes, it is. 2 more questions. Why is
Yeah.
brain awareness important to you?
I have watched, I can't even tell you how many patients go through recoveries from brain injuries. And some of them are just incredibly devastating and really hard for, them and their families. And one of the hardest parts is watching them kind of I don't like the phrase beat themselves up, but kind of carry a lot of guilt because it was preventable. And so if anything can, and not all of them are, just making that clear. But
Mhm.
if there's something that can be done to prevent it, and to just alleviate that potential awful situation from happening, I think it's so important. And my three big pieces that I'm a big stickler on. If you ride a bicycle past me and you don't have a helmet on, I will yell. It drives me nuts when people. I'm aware that it's not going to be perfect, and like you can still have an injury, but at least try. Put some effort in there,
Yeah.
especially for children.
Yeah.
So wearing helmets is a big one. Um, Safe driving. I don't know about everybody else, but I feel like in the last few years when I drive, people are just zooming past me and like not. It's just not pretty. So I can't tell you how many awful, heart-wrenching accidents I have seen. And so just safe driving, and particularly motorcycles. If number one worst injuries I've ever seen, they're all from motorcycle accidents. Um, Last is sports and making sure you have education on concussion and brain injury prevention and management for sports. So those are kind of my big three pieces that I'm big on awareness of, because they're the most, you can have the most impact on prevention there, which is important. Um,
Absolutely.
can I say one more thing?
Yeah. Oh,
So
yeah,
I was
that's
talking
what
about
I'm saying.
prevention, but the other thing about awareness is having the greater public understand that brain injury is often not always clearly visible, and people can have so many components of their injury that are not able to be seen by the naked eye. And just because you can't see their injury doesn't mean they don't have stuff going on. And coming back to the kind of that patience and understanding, that it's so important for people to be patient and understanding with each other, and especially survivors of brain injury, because you just have no idea what they've gone through. And even if they don't look injured, it doesn't mean they're not dealing with stuff. That's my other big piece of awareness. I'm
Thank
off
you
my
for saying.
soapbox now.
Are you fine? Thank you for saying that because a lot of people aren't in my situation in a wheelchair. A lot of people don't have canes or have noticeable aid that helps them do certain things. But like you said, just because they don't look like they have an injury doesn't mean they don't. So I know plenty of people who are walking around look quote unquote normal. What is normal? But because of the human eye, they don't look like they have something wrong with them. They're overlooked a lot of times. Not understanding that it's neurological. It's like when you hear them talk, it's like, oh, now I understand. Now I see. So this
Yeah.
person looking over does not mean they'll have everything things that going on with them internally, especially in their brain. So it's good to get to know somebody and not prejudge a book by its cover, is that to say? So get to know a
Yeah.
person. Wow. So what's next for you? I know you're gonna be a
Um,
mom. I know you're a mom for a third
I'm gonna
time.
yep.
Right.
Baby number 3 is coming in the spring, so that's kind of taking a front seat pretty soon.
Yeah.
But in the meantime, also I'm doing quite a bit of research. I've partnered with a wonderful colleague of mine, Dr. Lauren Zayaks, who works out in Utah actually, and we're
Mhm.
doing quite a bit of research, on specifically on concussion, but also just kind of in that realm of brain injury. So continuing to work on building some research and help promote that education. And then continuing to build my role in the Brain Injury Alliance, like we're talking about awareness and just support of that program, and to increase support to the community for individuals with brain injury. We host I should say we, but the organization hosts a brain injury walk for thought every year in the fall. We just finished ours. And just being involved in different projects like that to keep promoting awareness and education, and hopefully continuing to expand on that piece.
It's wonderful and beautiful. And I wish you all the best in your endeavors. Well, I thank you again so much for taking the time out out of your schedule to do the interview with me. I'm sure you have a class going on, but so I won't keep you too much longer. And as far as those in the physical therapy and neuro field, because it's such a much needed field to, you never know too much. The brain is so complex, it's ever changing. So you would never know everything about the brain because it's ever changing. So Thank you for taking
Correct.
time out to inform my audience and let them know, and sharing your wisdom with them, and your insight from your personal experiences. So may you have a very Merry Christmas, Happy New Year,
Thank you. You
and
too.
Merry Christmas, baby. So let me
Thank
know how
you.
to
And thank you so much for having me.
absolutely let me know how to stay connected with you.
It was so nice to meet you.
Let everyone know how they can stay connected with you, how they can find you and stay connected.
So I guess the best is I'm still not the best social media person, but on Instagram, my students have helped me work on this. My it's a handle, right?
Handle, yes,
Um,
handle.
it's at JTUCKDPT. So I'm always happy to field questions if you send me a message
Mhm.
on there. And yeah, so I'm happy to answer anything anybody has.
Well, thank you again. Thank you everyone for tuning in to hear Dr. Jenna's expertise. You connect if you see you connect with her with Dr. Jenna Tucker on Instagram at JTuckDPT. It's D as in dog, P as in Peter, and T as in today. So if you're still looking for neuro physical therapy information or any other questions, she said you can DM her. So by all means do so. And follow her to know more tips. She does information on her page all the time. So you can follow her and learn more about the neuro field, physical therapy field. Again, thank y'all for joining me today for today's episode. Hope you join me and Dr. Jenna Tucker and learn about her physical therapy journey. If you know someone who can benefit from this information Dr. Jenna shared, please share this video with them because you never know who can benefit from it. So we shared a lot of information today, so don't hesitate to share this video. You can connect with me on Instagram at Erica Walker 878 and YouTube Erica Renee Walker. So tune in. Oh, but this is the last episode for the season. So, wow. I just remember that again. It's the last episode. I think I forget for looking at the videos week after week and taking time out of your day to support me and to meet the different guests. And I hope you enjoyed meeting different guests, the therapists and the survivors alike and organizations. So I thank you all for tuning in season 3. It's been quite a daunting journey, but nonetheless, full of information and full of impact. And I pray you all have received something and I'm sure you'll learn a lot of information. So he'll be back next year for season 4. So excited. So yeah, season 4, TV Uncover will come back next year sometime. But Renee, remember we all have a story. You can change the world with yours. So nice to tell your story. See y'all later. Bye.